What if you got affordable universal health care at the ward levels in your neighborhood? With similar intentions, Namma Clinics were launched within the BBMP limits in Bengaluru. What are these clinics? What facilities do they provide? And are they doing a good job of providing services? I visited some clinics in the city and I'll tell you how that went. India's healthcare system is complex with both private and government-run facilities. Despite progress in the past few years, India's healthcare sector still faces challenges such as shortage of health workers, inadequate infrastructure, and load on government hospitals. A Rural Health Statistics report for 2021 released by the Ministry of Health and Family Welfare shows that there is a 7% shortfall of doctors at primary healthcare centres and a 57% shortfall of doctors at community health centres across urban and rural areas. Although the cost of hospitalization in private hospitals is 7 times the cost in government hospitals, many have no option but to pay for these services. And that's because of a lot of reasons. Only 30% of people go to government hospitals for their service. This is Karnataka's Chief Minister Basavaraj Bommai inaugurating one of the 108 Namma Clinics in Bengaluru. Does the name sound familiar? These clinics are established on the lines of the Mohalla Clinics established by the Aam Aadmi Party in Delhi and Punjab. While the Mohalla Clinics have managed to live up to a lot of citizens' expectations, Namma Clinics seem to have a lot to deal with.
I think the gap is that so far we have left it to merely administration. So you know what happens? If you look at the Mohalla clinics, even in places where they work, like you take Delhi, whether it's education reform or healthcare reform, the officials have not changed simply because a new program is initiated. The same people who previously didn't do all that they should have been doing are now doing a lot more. And I feel the reason for that is leadership. If there is ministerial leadership and administrative oversight, I feel all these problems will quickly get addressed. But if a program is announced, and even if there is administrative oversight, without ministerial leadership, it will not roll out the way we think it should.
For starters, this is what you find when you look up the address of Namma Clinics in the city. The search shows a private clinic by a similar name located in Sakar Nagara. This private clinic gets at least 100 calls from people confirming whether this is the government clinic on a daily basis. Going to the official website of BBMP is the only way a person can locate a Namma clinic of their ward for now. These are the 12 services that the clinics promise to the patients free of cost. The services include infectious disease management and diabetes, among others. Each Namma clinic is expected to cater to 10 to 15,000 people, but patients in some wards are opting out of these services.
ಇದೇ ಈ ಮೊಣಕಾಲು ನೋವು ಜಾಸ್ತಿ ಎದ್ದೇಳಕ್ಕಾಗ್ತಿರಲಿಲ್ಲ ಈ ತಲೆನೋವು ವಿಪರೀತ ತಲೆನೋವು ತಿರ್ಗಾ ಮೈ ಕೈ ಎಲ್ಲ ನೋವು ಎಲ್ಲ ಹೇಳಿದ್ವಿ ನಾವು ಚೆನ್ನಾಗಿ ನೋಡ್ಕೊಂಡ್ರು ಮೆಡಿಸಿನ್ ಇನ್ನೂ ಬಂದಿಲ್ಲಮ್ಮ ಏನು ಮಾಡೋಣ ನಾವು ಅಂತಂದು ಇಲ್ಲಿಗೆ ಅಲ್ಲಿಗೆ ಹೋಗ್ರಿ ಅಂತಂದರು ನಾವು ಹೋಗಲಿಲ್ಲ ಇಲ್ಲಿಗೆ ಹೋಗಿ ತಿರ್ಗಿ ಹೋಗಲಿಲ್ಲ.
These clinics are meant to prioritize healthcare for the vulnerable sections of the society, such as the urban poor and migrant workers. On the contrary, these clinics fail to provide even basic services such as glucose level tests. Another concern is that these clinics are open only till 4:30 p.m. in the evening, which leaves people with the only option of private institutions in case of health emergencies.
Ongoing request, not just from the health, those of us working in the health sector, or public health sector, but also from people who are working in the informal sector, from women, from senior citizens, because you need 24/7 healthcare facilities available, and sometimes like women working in the garments, every hour that they are not there, they lose wages. It's almost like people who are daily wage laborers or people who are in the informal sector, they cannot miss work to come and sit waiting in the clinics. And many of them have requested for evening clinics, and that I don't think that we have taken enough cognizance of that. And definitely in an emergency, like someone goes into labor, or someone gets some chest pain or any kind of emergency situation, definitely they'll need to have access to healthcare facilities, and all this has to be thought through, because again what is going to happen, people are going to go directly to say Victoria, Vani Vilas, or if they cannot wait there because there is so much overcrowding, they're going to end up again going into the private facilities. So unless it's seamless, healthcare has to be seamless, healthcare has to be comprehensive, and healthcare has to be available at all times when people need it, and in consultation with communities. Like even if a Namma clinic is located in an area where the majority of people are working and they're daily wage workers, they will tell you that we need a clinic in the evening. But this very top-down approach is a problem, and it leads to investments happening, but in terms of actual reach or implementation, there are a lot of gaps.
Everything that you've watched in the video so far is just the tip of the iceberg. We dug deeper and we found that the doctors in these clinics are unhappy too. From basic salary issues to not having enough equipments to function efficiently, doctors are either directing people to private clinics or using their personal equipment. One of the doctors spoke to us on the condition of anonymity.
One patient had a complaint of pain and unusual sensation in the ear, but the government hasn't provided any facility to check the ear, like providing us otoscopy or Buller's lamp. So I had to take my personal otoscope to the clinic and check the patient so that he would get the right diagnosis so that I could treat him. It's been almost 4 months since I have joined the Namma clinic, yet we are struggling to get the basic medications like iron tablets or paracetamol or cetirizine or painkillers like ibuprofen or diclofenac. We are sending patients to the Janaushadhi, requesting them to buy the medications from the Janaushadhi and come to the Namma clinic so that we can inject them or administer the medications to them. The most of the meetings are always one-way conversations. Whatever we ask, whatever we tell regarding our issues, grievances or concerns to improve the system or to improve the Namma clinic facility, it was all just one-sided conversation.
We reached out to the BBMP regarding these allegations, but we did not get a response until the time of filing this report. While the first phase of clinics has taken off, getting them going has clearly been a tough slog due to various reasons.
The primary health level facility is very important. In fact, it is expected to meet almost 80% of the healthcare needs of the city or the population, and for that it needs more than infrastructure. Unfortunately, with the Namma clinics and with a lot of announcements by the government, they say we are going to do this or we are going to do that. The infrastructure is put into place, but what is important is how well it's functioning. And for it to function, you need a lot of other investments. You need investment into human resources, and human resources, not just doctors. We need nurses, we need lab technicians, we need pharmacists, we need ambulance drivers, we need the group D staff or the cleaning staff. All of them have to be on full-time positions with, the salary should come on time, they should have dignity of labor. But all of this is very often missing. Even in many of the Namma clinics, even the doctor, the appointments have not been completed. In fact, we have many urban health facilities already in place in Bangalore, which could have been upgraded in terms of human resources and other resources.
Compared to the poorly maintained clinics in Matikere and surrounding areas that I showed you earlier, in JP Nagar's middle to upper middle class neighborhood, the Namma clinic presents well. Clinics in this area have all the essential drugs and enough healthcare workers.
Here they give our medicines and all free of cost. I have an auntie in my house. Earlier she used to go to doctors. I had to take her to a long distance for her checkups and all. Now luckily now I have started bringing her here. She is very happy about the doctors here. Last week, if I am correct, I brought her here for the regular checkup, and the doctor was out of this clinic since she had to attend one interview or exam, something like that, a departmental thing, you know. Then immediately there was a nurse here, you know, they said, don't worry madam, we ourselves will look into it, we will test you.
Namma Clinics were launched on February 7 last month. Giving some slack to the amount of time these clinics have been operational for, citizens expect all the necessary facilities to be available in the next few months. With camera person Kartik Govardhan, Rishika Kashyap for Deccan Herald.